We gave her the very high-dose steroids, and within a matter of several days assessed that they were not doing enough.
While Grace has not completely recovered, she is far from paralyzed. She can now move without her walker. She now feels empowered. But 2 months later, with no prior warning, the paralysis returns, stronger than ever, and takes back everything Grace has gained.
I couldn't imagine waking up and not feeling the lower part of my body.
Once again, Grace's life spirals out of control.
She knew something bad was going on because she now had 2 episodes of severe weakness in her legs.
We need an ambulance here right now.
By the end of the day, an ambulance has brought Grace back to the medical center.
I felt out of control. Nothing I could do, nothing anybody could do. The doctors didn't even know what it was. They treat her for one thing and it got worse.
Although there is no cure for transverse myelitis, it is rare for it to recur like this. Grace's relapse means there's something missing in her earlier diagnosis. The case is referred to the center's director of multiple sclerosis and neuroimmunology, Dr. Rock Hyman.
We have recognized in neurology that there is a version of MS that is different, really different than normal MS, and relapsing or recurring myelitis may occur. And when I met her, I thought she was an individual who had relapsing myelitis.
I will have to ask you a little bit about your family history, if that's all right with you. Tell me a little bit about yourself.
By now, Grace is a seasoned patient. She shares her medical history in elaborate detail.
I do need to do the blood workup, find out as much as I possibly can.
So we got all the blood tests for other immune conditions which can also cause this problem in the lupus family, weird diseases like Sjogren's or sarcoid.
While awaiting the results, Dr. Hyman gives Grace medication to fight the inflammation.
We gave her the very high-dose steroids, and within a matter of several days assessed that they were not doing enough.
The tests for lupus and all other autoimmune diseases come back negative. But there's another possibility. Dr. Hyman has researched a rare disease that might match Grace's symptoms. It could be the answer to the mystery. A sample of Grace's blood is sent to a special laboratory for analysis. Days pass while Grace waits for the answer. Will Dr. Hyman be able to solve the mystery, or is she on yet another odyssey of disappointment? The results are finally in. After endless rounds of testing and weeks of frustration, all Grace wants is an answer.
As you know, we have cleared the transverse myelitis. Preliminary results shows that it's a high possibility of being Devick's disease. Now, we're going to be very aggressive in the treatment.
The illness Grace has been fighting is Devick's disease, or NMO, neuromyelitis optica. Ironically, Grace has actually come across references to Devick's in her own online research. Although similar in some ways to multiple sclerosis, Devick's disease is harder to diagnose and so rare that many doctors have never heard of it.
10 years ago, I looked at it as a weird version of MS that didn't seem to behave the same. Now I'm looking at it as a different disease.
Devick's is an immunological disease much rarer than MS, with its own unique set of problems. In addition to paralysis, Devick's can cause blindness and even death.
My mother's diagnosis, it wasn't a very happy ending to the whole thing, but it was good to know what it is.
There is no cure for Devick's, but there is a treatment called plasmapheresis that helps Grace manage the disease.
It's gonna be okay.
The infusions that I take are similar to chemo infusions, and we've decided at this point to do it every 3 months, and the results look semi-promising.
Grace's life at the moment is on an upswing. Although physically weakened by her disease, she is still vital and looking forward to the future.
At this point in my disease, I've relaxed a lot. I have been relapse-free. It'll soon be a year.
But Grace Mitchell has come to terms with her illness and her life.
The worst thing for me was the period of time during diagnosis when we did not know what it was. Now, I know what it is, and it's not an invisible monster. You just have to pick yourself up and dust yourself off and get moving.